Data from the U.S. Bureau of Labor Statistics show that 5 of every 100 healthcare workers gets injured or ill at work. That is almost 2 times the rate of other private industries. And nursing assistants are over 5 times more likely to suffer a bone or muscle injury than all other workers in the United States.
That's actually true and truly shocking. And they're talking about us. In 2019, at RWJBarnabas Health, there were around 2,500 reported injuries, which is an average of 7 team members injured a day. Compared to construction, manufacturing, and nuclear power, these are all significantly safer for their workers. Construction and manufacturing, nearly twice as safe. Nuclear power, 20 times safer. In the bizarro world that is in fact reality, that means that the workers building a hospital are safer than the healthcare workers who will take care of patients inside. The good news is that our Safety Together journey applies to team members, like you, just as strongly as it applies to our patients. But when we say that healthcare workers are at especially high risk for injury, both physical and emotional, what exactly do we mean? We gathered a group of RWJBH team members to talk about some of their experiences on the job. Let's talk about physical safety first. No one wants this story to be their story. When Nurse Schuster raced to help a fellow nurse lift a patient at Crozer Chester Medical Center near Philadelphia in March 2010, she didn't realize she was about to become a troubling statistic. While working the overnight shift, she heard a cry, "Please, I need help. My patient has fallen on the floor." So Schuster did what most nurses would do. She gathered a few colleagues, and they lifted the patient as a team. I had her legs, a corner of one of the legs anyway, and as we swung her up onto the bed, I felt something pop, and I went, "Ooh!" She finished the shift in pain and drove straight home to bed. But after Schuster woke up late that afternoon, her husband heard her shouting. He says he ran to the bedroom and found her crawling across the floor. Schuster had injured her back moving the patient. A surgeon was able to repair a damaged disc in her spine using a metal cage and 4 long, sharp screws, which she still has to this day.
I can finally walk and sit again without being in excruciating pain. But the career that I had as a floor nurse is over.
It's heartbreaking. Here we have this nurse who spent all that time and energy and money to build a career helping others, only to have it cut painfully short. Literally painfully. What are some of the other ways injuries happen?
Slips, trips, and falls. If you almost trip or slip on something, be assured you're not the only one that's happened to, and it's only a matter of time before almost becomes a sure thing. It needs to be documented and fixed before someone gets hurt.
Needle sticks are a big one. We have to focus on the task and follow procedures and precautions every single time, because it only takes one error to result in injury.
There's also bodily fluid exposure. There are protocols that, when followed, will protect us, but a shortcut can have long-term negative effects.
Another injury is repetitive motion injuries. You can get hurt if you don't stay aware of what your body is telling you. We need to make accommodations to protect ourselves.
Then there's injuries from lifting or handling. It could be a patient, but it also could be almost anything you have to lift or move. If you're concerned about the safe handling of anything, get help. It's that simple. No one needs you to risk your own health to move something. Save those muscles for the gym.
You guys are so wise. The most severe injuries in healthcare are slips, falls, and then strains, and the most frequent injuries are cuts, punctures, and scrapes, followed again by strains. And now, what about emotional safety?
We need to acknowledge that healthcare is hard, emotional work.
Right. To normalize the feeling of drain that our work can be, and to recognize that being affected by the work takes an emotional toll.
And even if we are not the direct victim of trauma, like workplace violence or an especially traumatic case, or a sequence of bad outcomes on a unit, such as multiple deaths, our experiences and our emotions are still valid, very real, and potentially impactful on our psyche.
At RWJBH, your physical and emotional safety is just as important as the patient's safety and experience. We have been working hard at protecting each other and are continuing to improve. And our Safety Together tools, our behaviors, and high reliability culture will support us being even safer in our work and continue to reduce injury to our team members. We are looking out for you and also asking you to look out for each other. And we know this system is working because we've seen tons of improvement. Patient handling injuries have decreased by 43% from 2017 to 2020. Over the course of about 5 years, we were able to keep workers safer and reduce days of work missed due to on-the-job illnesses and injuries from 5,378 to only 297. And workers suffering from a slip or a trip or fall at work was recently reduced by more than 25%. Clearly, we're making progress, but we've still got over 300 slips, trips, or falls, and nearly 300 days of work missed due to illness and injuries. So we've still got a lot of work to do to get to zero harm. But we're up for the task, because we can't help our patients get healthy if we can't stay healthy ourselves. They need us. We need you. And we need each other on this journey. As your employer, we owe it to you to create the safest work environment, and will continuously strive toward zero harm. Did you know that healthcare workers are 4 times more likely to experience workplace violence than any other worker in the U.S.? In order to stop violence before it starts in our organization, we take threats very seriously by not tolerating them at all. This includes verbal threats, insults, attacks involving race, gender, ethnic background, or religion. Threatening and intimidating behavior will not be tolerated. From patients, from coworkers, from visitors, from anyone. Sometimes the emotional harm we experience is not direct or aggressive, but still very real. I want to share this difficult story with you. We must recognize the harm and the real impact on our team members of interactions like this.
I had been on the cardiac care unit for 3 years. One day I was on my way to give Mrs. Preston, an older patient who visits the hospital frequently, her meds. This time, I was greeted by Mrs. Preston's daughter at the door. She said, "I think it is best that you do not work with my mom anymore," looking at me and smiling the entire time. No offense, but Mom has difficulty understanding when you talk, and that makes her upset. It is bad for her heart, and I'm sure we don't want that. Plus, I'm not certain what they teach in the schools where you're from. It is probably different than here in America, right? Do you understand? Then she hurried down the hall to speak with Rose, the manager on duty. I couldn't hear everything she was saying, but from the words I caught, I could tell she was asking that her mom be reassigned. The next thing I heard was Rose asking, "Who is assigned to Mrs. Preston?" "I will take over for the rest of the shift." And that was it, no further discussion. I am just as much, if not more, qualified than any other nurse on our unit. I get great feedback from my patients and their family members and from our physicians. I am an excellent nurse. This wasn't about my ability. This was about the color of my skin and the accent of my voice. I was so upset, and I didn't feel supported by my coworkers or my manager. I hated coming to work. Finally, I couldn't take it and transferred to another unit.
This should not happen. We support our staff. If this happens to you or a coworker, speak up. If you feel threatened, please tell someone. But also, even if it's not something happening to you, we are imploring you to also stand up for each other. Because as we've said, you are hard workers doing hard work, and you don't need anything working against you. We need to have each other's backs. Another way we can emotionally heal is by utilizing the various programs in Connect Together, or encourage talking to peer support, or take advantage of the Employee Assistance Program. We can and will prevent harm at work. Thank you, Armando, Fatima, Fukashi, and Youssef. Be careful out there, and in here. How about everywhere? Because remember that when you're faced with a situation that has the potential to leave you injured, we can have a lapse in situational awareness and get injured, and then we can all learn from what happened to you. Or what if you just didn't even take the chance? Please don't take the chance. Safety, together.